All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. We're here doing some male facial sculpting tonight. One of my favorite fillers. We're going to be using Define to define his face tonight. Why are we doing this? Because he already looks good. He's young, looks great, but I want to enhance these features. This beautiful smile needs to have a beautiful chin, needs to have a lifted cheek, and it needs to have softened, unhollow eyes. We need him to look bright and youthful. We don't want him to look tired or having dark circles. So you guys can see one of the features on him, he has a lot of mid-face volume, but his cheek has a lot of, doesn't have a lot of projection. So we need to use filler here to build this out. Also, his cheek area has a lot of height, but it doesn't have a lot of volume in the middle part of the face that gives that contour and helps the under eye. So that's an area where I find people in their 20s and 30s, they come to first, they say, look at my dark circles. So we want to make those better. So we're going to focus on, we're going to start on his chin. You can see we're going to go right onto the bone. We're going to use Define. We're going to build a little structure here. He's doing great. You guys can see that's filling out. Awesome. So this is a hyaluronic acid. And this is going to be nice right on the bone. It's very safe. And this will give a lot of lift. Look at the difference already in just that small amount of time, amount of filler. And what it's doing for lift. Okay, take a look.
Dr. Niamtu said, looking good, bro.
Oh, I love you, Niamtu. Dr. Niamtu, you guys, just so you know, one of the best facial plastic surgeons or maxillofacial surgeons that exists. He taught me everything. So I'm glad that he's watching. So now we're going to do just a little to that mid-face.
How about the temples?
So we could. It's not a priority area for him. His priority areas are the enhanced feature areas, which are his cheeks and chin and under eye area. So I want to focus on, he looks actually totally fine. His temples could have some, but look, his lower temple, his border of his upper orbital rim is not visible. So because of that, he has good volume. And yeah, because he has a shaved head, you can go a little bit further back.
Someone said, I need you in Boca Raton. You can come see us in Miami.
We were just there, you guys. We're in Miami.
We'll be back in June. Back in June. Send us a DM, full name, email, phone number.
So our goal here, as you see with his facial structure, is to get a lot of mid-face support. And we're going all the way down on bone, going to different, some of the fat pads here, specifically the deep medial fat pad.
Someone needs to order Rev Peel from us, guys. You can go to emeragecosmetics.com. Make sure you do your virtual consultation.
Easy to do.
For any Rev products.
Easy to do. You guys know how often I'm peeling.
Come to Atlanta. We need you down here. You can see us in Florida.
I want to have a practice in Atlanta, but we're building up right now in these other areas. So give me a little bit of time. So you guys look, even that small bit, look how much volume it did for lifting, helped his folds. We're going to go back and do a little bit more on the chin now. So again, I just want to build even a little bit more structure for him.
People are saying Boston. Come to New York.
We're in New York, you guys.
We'll be there next month.
A lot of patients from Boston.
Someone said, or Jersey. New York, guys.
Jersey, all my patients from Jersey come to New York. They like to go out to Manhattan anyways. Now look, you guys, look at that second syringe just did. Take a look now, if we pan, that's a really nice improvement there. Now lastly, I just want to soften that under eye area. Because for him, his dark skin has a little more darkness there. So
they're saying Brazil.
That's the next step in the future.
How long does this last?
So this will last about a year, sometimes a little longer, although we're doing a touch-up now after about 9 months. That looks nice. One of the things you want to be careful about when injecting the under eye is not going directly into the tendinous insertions between the nose and eye. That's true. Joe says that my biceps are strong enough to push the filler directly through, so I have to be careful, I know. I've been working out a lot, making sure I don't push too much filler at once. That's great.
What about the width of a male's chin, will you need to inject outer at all?
Well, his chin has a lot more retraction and needs more filler, but he also has his muscles, you see right here, have a split. So you don't want to overdo the amount of filler there because it's going to make it look more like it's more split. So we're just going to even it out superficially. Just give him a little more squared look. Beautiful.
Thank you.
Oh yeah, you'll love it. And he doesn't need a lot. Perfect. I think that's great. Softening and enhancing, and not letting anyone know. So we're gonna do an Emer reveal. We're gonna do an Emer reveal, okay? So we're gonna give you the phone, and we're gonna have you take a look and tell me how amazing I did.
Okay.
Okay, but how good you feel you look. All right, take a look.
Oh my.
Grab the
Take
phone.
a look, grab it. Look at your chin. I want you to look at your chin because I'm very excited about it.
Oh my gosh. It looks
Turn to the
really
side.
good.
Turn to the side. Zoom in. Come in close. Come in close.
Oh, it
Look at
looks
the chin.
amazing.
What do you think? So we need a little bit more, but I think for the couple syringes it came out great.
Thank
Hold
you.
this up a little higher so you can see the angles on the cheek. On the cheek. Little angle and a little softening. Smile so you can see that there's really no hollows there anymore.
Yeah.
What do you think?
I like it. It looks good.
What was your goal?
My goal, I mean, you accomplished my goal. My goal was to like fill out my middle area in my face, and you accomplished it.
Perfect. So now we got, what I like is we have a little bit more definition in your chin and jaw because we really worked to build this out. We have some lifting here that separates because your face was a little more round. It gives a little more shaped appearance. And now the under eyes don't look as hollow.
Yeah, it looks like I feel like I look rested.
Exactly. That's what we want. Youthful and rested. Now take a look in the actual mirror. What do you think?
Oh, it looks amazing.
Yeah.
It looks good.
Fits the nice smile.
Thank you so
So,
much.
all right, do a pan, show everybody, show off. You can show off right now. This is the time. Let everyone see how good it looks.
Thank you, guys.
And we'll get more information in the next couple weeks on how he looks, you guys.
Okay.
Have a good
Thank
night.
you.
Good job.
Thank you. Thank you, doctor.
You're welcome.
Thank you all.